Hello and namaskar. I'm Dr. Dimple Kaur, and today I'm going to introduce you to the trauma-informed system within the applied Natya Therapy. Welcome back to my channel. What is trauma-informed system? What is trauma? Something that hurts you so deep that you are not able to function at your fullest capacity. But when you go for meeting people, talking to people about their trauma, something they say hurts you more. It triggers those trauma further, and you start to cry, and you start to feel more hurt, and the trauma gets intensified. What is it about words that hurt you? What is it about the words or the talks, what other people say, that triggers those traumas? The memories, the emotions, the pain, the fear, all that is keeping you closed, all that which is stopping you from taking the next step. That is what trauma does. It blocks every possible movement, because after the trauma you're scared. You're hypervigilant. What's happening around you? Is somebody after you? Is somebody going to hurt you again? Are you going to fall down again? With that fear, you don't take the next step. And some people, they make an effort to go out and talk to people, but the people who are your friends, family, colleagues, maybe they don't understand trauma so well. So they say something which you feel, no, not this. It's hurting more. Trauma-informed system means that you're aware what can trigger the pain again, what can trigger the thought process again, what words can actually make you start fearful, become fearful again. What are those words? What is that agency that helps you come forward? And that is the system we have applied in applied Natya Therapy. Fully trauma-informed, to be very aware what trauma can do to a person, to approach it very safely, to create an environment where a person feels safe to share their deeper issues, their deeper fears, their hurt, their pain, their emotions. Trauma-informed is a specific system wherein we understand empathy, we understand the power of words, we understand the power of emotions, and we understand the wounds and the pain caused by those wounds. So as a part of applied Natya Therapy, this trauma-informed system, we create a safe space for those who want to explore their emotions, their traumas. They are safe to go deeper into the trauma, share that feeling, that emotion, rebuild their connection with their own emotions. Because the biggest part of trauma or any kind of hurt is that we start to disconnect with our own self. We stop taking care of ourselves. What is the first sign of depression? We stop taking care of ourselves. As if I am not important. As if I don't matter. And that disconnect leads to other disconnects with family, with friends, with society, with work. And a person is not living to their fullest potential. The spiritual aspect of applied Natya Therapy is all about finding that connect with the deeper soul, that deeper divine self. That emotion which is hurt and is not able to surge back. So when a person starts to move slowly, in the safe environment, not being triggered by words, actions, expressions, gestures, but given those as a form of exploration of their own emotions, to be able to express those emotions and thereby finding resilience through creativity. That is the whole essence of trauma-informed therapy, which we apply with applied Natya Therapy. So I hope this helps all those who are practicing some or the other form of therapy, and to those who are going for therapy. Please ask if your therapist understands what is trauma-informed. And for you also, if something is triggering you, say it. Okay, stop, take time, pull back, go more slow, make it more slower. There is no rush, because these things will come together step by step. Thank you for listening, and I hope this trauma-informed system is helping you to understand, explore, emerge, and evolve as a human being. Thank you.